You're watching Global Halifax. This is Global News at 6.
We want to begin with a troubling increase in the number of new HIV cases diagnosed in Nova Scotia. So far this year, they've jumped 100%, and that has prompted an urgent advisory for healthcare providers. Now, some are calling on the province to fund a preventive drug in response. Alexa McLean has the story.
Public health officials in Nova Scotia are searching for answers behind a dramatic rise in newly diagnosed cases of HIV.
So normally, in an entire year, we would see about 15 to 17 reports of HIV in the province, and we've already come close to that number halfway through the year.
An urgent medical advisory was sent to healthcare providers across the province, alerting them of the increase. The Nova Scotia AIDS Coalition says more information is needed to know how serious the increase is.
If the number of people being tested has increased, then we could be seeing a consistent rate of HIV infection. But if the number of people being tested has remained the same, then we're seeing a spike in HIV infection, which is very concerning.
The important thing is that people get tested because approximately 1 in 7 Canadians is unaware that they're infected with HIV if they are infected.
Public health officials continue to encourage the use of condoms as the best line of defense in preventing HIV. Now, sexual health advocates say it's important to recognize that human nature means condoms won't always be used, and they feel there's an even better line of defense in the form of a pill that should be publicly funded.
PrEP is short for pre-exposure prophylaxis. This drug is up to 99% effective if taken every day.
Matthew Newmer is an assistant professor in sexual health at Dalhousie University. He says 4 provinces in Canada currently publicly fund PrEP, and these new HIV results mean Nova Scotia should as well.
While we're increasing by 100%, we've seen other areas decrease their rates of infection by 40 to 50%.
The province won't make any commitments on funding for PrEP, saying it's only looking at expanding access for those at high risk of HIV infections. Alexa McLean, Global News, Halifax.